Okay, folks, let's start. So thank you so much for joining us this evening. This is the first of our 2024 RTUK Talks series, and a warm welcome to you all. And although this is a series built for the workforce, we very much welcome any patients who've joined us here this evening too. So last year's talks were about new developments and innovation, and they were really, really popular, and they are still available to view on our website. And this year, following on from the feedback from the attendees of last year's websites or webinars, our theme is enhancing the patient experience. So my name is Sarah, and I'm the Director of Radiotherapy UK. We are the only charity in the country advocating specifically for this life-saving, cost-effective, curative treatment, and the patients that receive it and the workforce that delivers it. And with your support, we're here to create change at the highest level through our award-winning Catch Up with Cancer campaign. And I have some really good updates about the campaign after our guest speaker. So I'm joined tonight by Alison and by Lindsay, who will help run the session. Lindsay worked as a therapeutic radiographer for many years and will be helping out with the questions section later this evening. And Alison will also be helping out with looking after our chat. And tonight's guest speaker is Jo McNamara, a dedicated and vocal advocate for the radiotherapy community. Jo is a senior lecturer at Sheffield, training the next generation of therapeutic radiographers, and is also co-founder of the award-winning Rad Chat, the only oncology podcast hosted by therapeutic radiographers. We are also super lucky to have Jo as a Radiotherapy UK ambassador, supporting our work for patients and campaigning for equity of access to high-quality radiotherapy. If you're heading to this year's Oncology Professional Care Conference, you'll find Jo hosting in the Rad Chat Radiotherapy Theatre, and we'll be there too as event partners with a stand right next to the Rad Chat Theatre, so please do come and say hello. So Jo has a talk for us tonight that features some really excellent insights into supporting patients with great prehab advice before they have radiotherapy treatment, and then using some of that advice to also help look after yourself as a healthcare professional. It's a huge and it's a really complex subject, and I know that Jo has an awful lot to share with you. So just very quickly from our end, please do use the chat function to introduce yourself, and for any comments or questions, this is a really good opportunity to engage with each other and Jo. And we have a question and answer section after Jo's talk. And we'd also really appreciate it if you could comment in the chat with your main takeaway after Jo's talk. So without any further delay, please welcome Jo McNamara.
Oh, thank you so much. It's an absolute pleasure to be here this evening. I am absolutely delighted to be a Radiotherapy UK ambassador. I love the work that the charity stands for and all the work that you're doing to support the workforce. So thank you very much. So if we can move on to the aims of the slides. So in true lecturer style, I just want to kind of go through what you're going to experience this evening, which will hopefully be informative and enlightening for you. Please be aware that for anyone listening who's potentially going to go through radiotherapy or has gone through radiotherapy, some things might be slightly triggering. And if you are affected by anything that I say or any of the questions and answers within the chat function, please do let us know and we'll be able to offer you support at the end. Please be aware that the information that I'm presenting is evidence-based. I utilise lots of literature and research within my talk, but please be aware that there are variations in practice across radiotherapy departments, and it's always best to speak to your healthcare team as you're going for radiotherapy. So the presentation's been written with healthcare professionals in mind, but that doesn't mean that hopefully if we have any patients listening to this talk that there won't be things that you'll be able to take away from it. And I recognise that in the way that I talk, sometimes I might refer to patients, and I just want to be aware that that's just what I'm doing for this talk. But I also appreciate that sometimes people don't like being called a patient, and I just want to recognise that. In the same way that I'll also be talking about therapeutic radiographers, and I know that potentially we might have radiation therapists who do the same job, just have a different title listening in the audience. So I'm going to use my HCPC registration title just in terms of the terminology that I use. So please do ask questions. It's great to get some discussion and also thinking about service improvement and service development. So if we can move on to the next slide, please do get your phones out. So you might be listening on your phone, so it might be slightly tricky for you. However, I'm very fortunate to have my Rad Chat buddy in the audience who will be sharing some links to some of the things that I'm posting. Essentially, I've created some QR codes to help support you in your learning as you go through the presentation. There are lots of snippets of information, which means that there's lots of continual professional development that you can do in lots of these areas. And I've linked to literature and research. So it's really important, if you can, to kind of go away and maybe digest everything that I've said and also look into areas in a bit more detail. So next slide, please. So this slide here, you will see that the National Cancer Patient Experience Survey, which is essentially for cancer patients to give feedback around the care that they've received. So the feedback is really important for us to understand where care is working well and also where it needs to be improved across England. The results of the survey are actually available to service providers, and it's a great way for you to actually engage with that feedback to see about how potentially you might want to change services. It's really pertinent to consider how patients' experience of cancer varies according to their individual circumstances and the type of cancer that they have. And also, the data reveals very much about, different people's experiences of cancer care. And having visibility of these differences is really, really important, because actually when we start to think about prehabilitation and implementing it into practice, we need to be aware of maybe health inequalities that exist. So for anyone working within radiation services, please do consider checking out your National Cancer Experience Survey, or if you live outside of England, think about potentially other variations in the data experience surveys, and essentially thinking about that whilst you're looking to develop and improve services. Next slide, please. So, preparing for radiotherapy. I would like to think that most people in the audience actually know what radiotherapy is, but I think it's always a great opportunity to just make sure. So radiotherapy is a very personalised, high ionising type of radiation that is produced using a linear accelerator, and it's designed to damage cancer cells. It can destroy them, it can shrink them, it can affect the cell structure, and essentially it's the second what most widely used treatment for cancer, and attributes to 40% of cancer cure rates. It is, however, underutilized, and I do not want to take the amazing message that Sarah's going to talk about at the end about what Radiotherapy UK is going to hopefully try and help to address this. But I think it is really important to consider that we're not utilising radiotherapy as maybe we should be doing here in the UK. So when thinking about how to prepare people for radiotherapy, we have to think not just about the patient, but also about what the services are and potentially what the patient's gone through in terms of the service pathway. So delivering radiotherapy treatment alone in a silo potentially means that we're not able to extrapolate some of the chance interactions that we have with our patients. At an undergraduate level for therapeutic radiographers, radiation therapists, we absolutely learn everything about oncology. I absolutely know at university, we do not just study radiotherapy. We are experts in the entirety of oncology. And yet actually what I typically see within radiotherapy departments is maybe treatment radiographers not being able to utilise their skills about the other treatment modalities. So it's really important for us to consider the entire treatment plan and how we can personalise that, thinking about other treatment interventions that patients are experiencing. So as an example, think of patients who come to us prior to surgery. Do we utilise that time to reiterate prehabilitation prior to surgery? I would anticipate that the answer would be no. A phrase I hear a lot from patients is, I've been told to wait and speak to someone in radiotherapy about radiotherapy. And actually, a lot of the time, that's too late to actually implement any prehabilitation or even adequately prepare patients. So could we work with our colleagues from surgery and chemotherapy to ensure that they know about radiotherapy and about the prehabilitation advice that potentially we may want them to share with patients and their families earlier on in the pathway. Next slide, please. So these little video clips here are essentially social media content that we've created through Rad Chat. So Rad Chat produces bite-sized social media to try and prepare radiotherapy and other radiation treatments, offering information and support. So it's designed also to offer a wider MDT and CPD for therapeutic radiographers. And on Rad Chat Instagram page, we typically see about 60,000 interactions a month, and have daily messages from people asking about their radiotherapy, how they can prepare, talking about late effects. And we're seeing a huge increase in how social media is being used to help educate patients. So many trusts now utilise social media to connect with their patients and provide information. We've learned a lot through our work with Rad Chat, and I think it's important for anyone considering using social media about maybe how to use it appropriately. So obviously, Naman and I, who I run Rad Chat with, we work within our scope of practice. You know, if patients are asking us about things that we wouldn't do as a therapeutic radiographer, we're really keen to make sure that our area of expertise is in radiation treatments. It's also really important as well to think about the medical and legal obligations that we have and the implications of giving false information. So Naman and I have insurance to help support us if in any case something were to unfortunately go wrong. So, you know, the impact of using social media has to be considered, but I think from our experience, it's been an absolute delight to be able to support patients in this way. And our advice would be to work with trust comms teams. You know, communication teams are amazing. I'm looking at Alison. And what I would also suggest is that, you know, take them for a coffee, bring them into the radiotherapy department, because I promise you, once they've seen the equipment, they've met the staff, they've seen the impact that therapeutic radiographers, oncologists, dosimetrists, physicists have on our radiotherapy patients, how would they not want to help you create social media? Also a shameless plug, if any patients or staff want to collaborate with Rad Chat, we're always looking to help develop the social media content that we essentially provide. The concept of preparing people for radiotherapy in a range of methods is really important. So I've talked a little bit about social media, but actually we need to be really mindful about how people are accessing and digesting information. So we need to be mindful of health inequalities, what access people have to devices, digital literature. You know, the average UK reading age is 8. So when we are starting to think about how we educate people about what it's like to have radiation therapy, it's really important that you consider the terminology that you're using. There's also the concept of misinformation or misinterpretation. I absolutely know that, you know, I've had experiences as a therapeutic radiographer where I've given advice to a patient and they've taken it very literally. And you think, oh gosh, you know, I need to readjust how I'm maybe presenting some of that information. It's also thinking about wider demographics, so supporting people with learning difficulties, disabilities, and also being able to access things in a variety of languages and making sure from that perspective that we're equitable. Next slide, please. So these are just some lovely quotes. I couldn't not use these because it's the patient voice and it's why we do what we do. Now, I always thought I was a good radiographer, and actually working with Rad Chat, I've absolutely seen how talking to patients on a deeper level, I maybe appreciate now more things that could improve their experience, their well-being, much more so than when I was practicing clinically every single day. So we're in the process at the moment of writing a publication through Rad Chat about, you know, the implications of using social media and collaborating and working alongside patients. But there are some amazing projects that are already doing this. So we were involved in Radiation Reveal, and there's also the gynae narratives. So we had Lisa Ashmore on the podcast talking about a collaboration between Lancaster University in the northwest of England and the Clatterbridge Cancer Centre, and how they're using the patient voice to drive service improvement. So some amazing work that, again, you might want to look at. Next slide, please. And so these are just some quotes that are slightly different, because these quotes just demonstrate how some of the ways that patients have utilized the social media to prepare themselves for their radiotherapy experience. And actually, as you can see from some of those quotes, they wouldn't necessarily have been able to cope with radiotherapy in the way that they did, or their experience might have been affected had they not have been able to access some of that social media content. Thank you. So this is just a QR code. If you're interested, please do go and have a look. Shameless plug, but it's a way that we can collaborate with the amazing workforce. So I'm going to move on now to the crux of what it is that we've come here to talk about today. And essentially, we're going to look at personalised care. So personalised care simply means that patients have more control and choice when it comes to the way they are actually cared for and the way their care is actually delivered. So taking into consideration maybe some of their needs, preferences, and their circumstances as well. So complexity and uniqueness of an individual will absolutely need to be taken into consideration by the healthcare team. And actually that can evolve over the course of the treatment pathway. It's also become apparent, and it's definitely fundamental to the way that we're offering care now within the NHS, but choice is important. You know, when you get a cancer diagnosis, often the choice of things that you want to do in life are taken away from you. So it's really important to think about how we can actually embed choices for our patients in everyday care that we deliver. Simple things that I've learned about is, would a patient like a gown, or would they much prefer to be in a vest top and move their vest top when they come for treatment? You know, it's very simplistic things like this, but it has a real effect on patients and their experiences. Personalised care represents a real practical change within the NHS, and it's almost palpable really in terms of some of the things that are evolving as a result of that. So when we think about radiotherapy and put that into context, we're thinking not only about the personalised technique that we're maybe using for our patients, but we're thinking about the time of their appointments. You know, are they able to work when they come for radiotherapy treatment? Are we able to facilitate their family accompanying them? Do they need to be an inpatient? You know, there's all sorts of things that potentially we might adapt so that their radiotherapy treatment can be personalised. And choice and decision making often can empower people, and that's outlined repeatedly through the NICE guidelines, and is something that we should be doing as a standard. The draft cancer packs are about to go live, which is really exciting, and actually the promotion of personalised care and physical activity is integrated within that. So it will be really exciting to see what happens as part of the general election, to see how these get actually facilitated through those cancer alliances. Next slide, please. So what is prehabilitation? I've talked about it a few times now. So prehabilitation enables people with cancer to prepare for treatment. It promotes healthy behaviours in order to hopefully maximise any emotional resilience, but also hopefully improve long-term health. So not only will prehabilitation hopefully empower people because they'll know what to expect, they'll feel prepared, but also to enhance their own physical and mental well-being, and also thinking about longer life. You know, it's amazing now that we have treatments that will cure a patient's cancer, and it then means that actually we have the opportunity to develop positive lifestyle changes for our patients that will ensure that they don't have other comorbidities later down the line. One of the phrases I hear a lot of people in prehabilitation saying is that, you know, you wouldn't run a marathon without training. It's a phrase that we often coin, and it's exactly the same. I would say having a cancer diagnosis and going through cancer treatment is harder than running a marathon. And so, you know, why would we not put exactly the same amount of training and support into getting someone through that journey as we would for a marathon? I've got friends running the London Marathon and they are well into their training, and we're only in February. So, you know, we kind of need to get behind this prehabilitation and see the advantages of it. I'm really biased because I teach prehabilitation, and I've seen the effects of patients who've had really good prehab and the impact that it has on their lives. but also their families' lives. If you're living a healthier lifestyle, and I certainly know, my child sees me exercising, oh yeah, I might go for a run as well. Or yes, I'll come out on my bike as well. So, simple health style changes can actually affect the entire family as well. Next slide, please. So for anyone who has ever looked at prehabilitation will probably be familiar with this diagram. It's quite a famous one by Macmillan. And essentially, this diagram looks at that continuum of prehabilitation, treatment, and then rehabilitation. So prehab has the power to ensure people are less vulnerable to the side effects of cancer treatment, so that they are as healthy as they possibly can be physically and also psychologically, because we often forget that aspect of care. And then people with cancer who have that poor physical and or mental health are known to have less treatment options available, or maybe be more vulnerable to the adverse effects of some of the cancer treatments. And also thinking about long-term health prospects, they may also be worse for those patients. So prehab's always going to sit within that broader context of health improvement for people with cancer. And that could also include things like smoking and alcohol cessation. It might be things like medication review, management of long-term conditions. And I would say, even for me as a therapeutic radiographer, I wouldn't necessarily always think about those things day in, day out when I'm treating patients. But having that prehab started to be instilled in what we're delivering, that is something that potentially we might start to do. Prehab's always been a consideration in surgery. If you speak to anaesthetists, it's their bread and butter. It's part of what they do. And, it's well implemented into that pathway. However, the true impact on patient health and prognosis is now starting to be seen across other healthcare interventions, when it's implemented across different pathways by different healthcare professionals, and part of a much wider team. And preparing people ahead of treatment is hopefully going to have lots of effects, but some of them could be about reducing post-treatment complications. So we're very fortunate now in radiotherapy that we're seeing the development of late effects clinics. If we're doing more work for prehabilitation, will that have an effect on those late effects? Hopefully and potentially. The prehabilitation gives us an amazing opportunity to provide a teachable moment. So for things like smoking cessation and alcohol cessation, you would typically think that a cancer diagnosis and going through cancer treatment is not the right time. But actually, when do you ever have the support of healthcare professionals every single day? You don't. And so actually it's a perfect moment for us to start to educate patients and support them at the hardest time possible, and to also deliver that teachable moment. Prehab has the ability to enhance quality of life. It could improve nutritional status, improve cardiovascular fitness, improve mental health, and also it could put mechanisms in place that maybe patients haven't had or won't have if they didn't have that kind of prehabilitation engagement. It is important to consider screening. So for anyone who's maybe working within a radiotherapy service, who's thinking about, okay, this all sounds great, Jo, let's implement it. There are things that potentially you need to consider, like screening. So you need to be able to screen the patients to think about, do they need universal prehabilitation? So that's kind of what I'm talking about today. Do they need targeted? And that's maybe specific things that patients need that's very personalized to them, or do they need specialist intervention? So do they need a physiotherapist? Do they need a psychologist for that specialist prehab? On completion of prehab screening, we also need to make sure that actually that's communicated to the MDT, and that we are actually documenting that, so that then we can measure impact, but we can also compare and contrast those interventions. So there's lots of tools, which I don't unfortunately have time to go into, but one of them is something like a sit to stand test. And that's something that potentially is quite easy to implement as a screening tool. So let's have a look at how we're going to implement prehabilitation into radiotherapy. Next slide, please. Okay, so physiotherapy. So people undergoing surgery will typically see a physiotherapist if they're lucky, or they may have the iconic leaflet that the physiotherapy maybe professional, or sometimes it's the nurse, hands it to them and says, right, okay, this is what you've got to do. And obviously we need to consider that that's often in a literary form. We also need to think about, is that when the intervention stops? So, you know, the physiotherapist comes in after surgery, hands a leaflet, maybe shows a few of the exercises, and then says, on your way, good luck. If you need anything else, then by all means get in touch. But we know it's not easy necessarily to be able to access that kind of support afterwards. So, you know, at what point do patients get advised about specific exercises that are going to help them cope with radiotherapy positioning? Kat Tunnicliffe from Percy Health, who I've got there on the screen, actually collaborated with us for Rad Chat, and we haven't got time to show the video today, but she's done a whole series of videos that essentially shows how we as therapeutic radiographers can support our patients whilst they're coming for treatment to learn some of the exercises that they should be doing. Now, you know, for breast cancer patients specifically, you know, the shoulder dysfunction is something that they quite often will see later on in life. And as a consequence of that, they may need to keep these exercises up for life. So Kat's tip is always brushing your teeth and doing your shoulder exercises are absolutely key. But it's tips like that, practical tips for patients that could potentially have a lifelong lasting effect and improve their quality of life and stop them from going on to develop maybe some of these pathologies. So do you know, in your departments, do you know the physio who sees oncology patients? Have they ever visited the radiotherapy department? Do they know the positions that we're trying to get our breast cancer patients in? Or do they know about maybe some of our bladder or bowel prep that we're asking patients to do? You know, every patient, depending on where you're having treated, will have a very personalised radiotherapy. And actually, for some, physiotherapy might not be required. But actually, for some people, it could absolutely be an intervention that's required. Does it need to be the physiotherapist that actually initiates that intervention? Could it be us as therapeutic radiographers? And especially for, again, reiterating to patients, they may have had lots of dealings with a physio, but during radiotherapy they don't. So could we be that voice to hopefully help stimulate their motivation to continue doing those? It's also really important to consider the role of physio across lots of cancer sites. So we know from the data, from the patient experience data, that people have different experiences depending on where their cancer is, which is very, you know, it is an inequity that we need to look at. Much of the information available quite freely, even on Google, is quite commonly associated with breast cancer and also prostate cancer. So it's starting to think, actually, what support and interventions are there for our patients who have head and neck cancers? You know, is there anything for our young adults or pediatric patients? So, you know, it is important to kind of think outside the box and think about what else is available. We do have, we had Isla Veal, who's a Macmillan specialist oncology physiotherapist who works at Guy's, and she is incredible. She has just worked with her Cancer Alliance to create a series of videos across all the different treatment sites. And as a therapeutic radiographer, and for anyone working in oncology, they are brilliant in teaching you how to support patients with specific exercises. So definitely do take some time to check that out. Next slide, please. So the next thing I'm going to talk to you about is skincare. So we're quite famous, I would say, for talking about skincare a lot, largely because of the amazing work that Namanjolka Anderson is doing at the moment around health inequalities. And I have learned absolutely loads about the skin. And I used to teach, I still do teach the skin, or the integumentary system, as my students know it. But actually, it's really important because, you know, it's a side effect that a lot of our patients are going to experience. And I would consider that a lot of people listening, if you are working within oncology, you're probably pretty au fait with the skincare instructions that you would give to patients. However, what I would say is that not everyone is necessarily thinking about utilising the Society College of Radiographers skincare guidelines. So, you know, making sure that your department is using those is a really good way for you to start to think about prehabilitation and when the patients get this information. Something that I find really, really interesting is about behaviour. I think it's the A-level psychology student in me. My teacher would be very proud. But actually, it's about the opportunistic health behaviour advice that as healthcare professionals, we give to patients. And hopefully, you know, in a daily reminder to our patients to change their actual behaviours. So it's important to give simple advice, so quite basic advice on how to make maybe those healthy actions and turning them slowly into habits. So things like skincare is a really nice, easy way to almost mention every single day to ensure that patients are doing it and creating that habit. And it's typically associated with something called behavior change management. And there are some amazing toolkits out there. So if there's something that you're interested in, definitely go and have a look at it. But advice for creating habits is easy, I think, in radiotherapy because we're seeing them so frequently. Research suggests that to create a habit, you need to do it for 66 days. So, you know, for a lot of our patients, we're not having that extended period of time with them. But if they are going through surgery all the way through to then get to us in radiotherapy, could we be liaising with the wider multidisciplinary team to offer patients advice after their surgery on maybe wound care, thinking, you know, if you're going to go for radiotherapy, you might want to start with this kind of skincare now and start it early. A lot of clinical nurse specialists who see oncology patients at surgery advise patients to use bio oil. So, you know, some guidance from the clinical nurse specialist about the fact that they'd want to stop that before going for their radiotherapy is useful information. But again, it's around that cross-pollination that we see within the different disciplines. So definitely check out the Society College of Radiographers skincare guidelines. See if it's something that you're definitely sticking to within your practice. And I'd also suggest checking out Numan's work because he's looking specifically at the assessment of radiotherapy skin reactions on people with colour. And it's an area that we definitely need to see a change in practice. Right, so the next slide is about physical activity. So this is what people typically associate with prehabilitation. When you say prehab, everyone goes, oh, she's going to talk about running. No, I'm not. I might talk a little bit about running, but you know, that's not essentially what prehabilitation is. If you take nothing away from today, I would love you to consider the role that physical activity can play in cancer care. I love to advise people about kind of the role that activity can have, and it doesn't have to be exercise. You know, the terminology that we use can actually affect how patients feel about what the advice is that you're giving them. If you say, oh, you need to do very aerobic exercise, you'd probably see a lot of them eye roll and go, yeah, that's not going to happen. So it is about how we pitch things to our patients. So someone coined the term of an activity snack. It's not my idea of a snack. I love a bit of banana bread, but an activity snack is a great way to think about it. So the research suggests that every 30 minutes, you should be standing up for 5 minutes. Now that sounds quite a lot, but actually it has a significant impact on lowering blood sugar and also our blood pressure compared to those who sit continuously. And I know from COVID times, you know, we do a lot of sedentary work now. We do lots of things virtually. And even as therapeutic radiographers who walk about 6 miles a day. I think that was the last piece of research, although that wasn't when there was auto sequencing. So maybe they don't walk as much now. But it is important for us to really consider, you know, are we being active? Are we stopping ourselves from being sedentary? The Department of Health and Social Care has recommendations specifically on physical activity. And the current guidelines are that it advises that healthy adults do one of the following every week. Okay, so wait for it. There's 150 minutes of moderate activity. So this means activity that's going to make you breathe harder, get your heart racing. 75 minutes of vigorous aerobic activity. So that's literally where you are panting. You maybe can't have a conversation. Anyone who's ever gone for a run with a friend, I can't do that because they want to chat and I'm like, I can't breathe. So yeah, thinking about maybe that style, but 75 minutes, and then 75 minutes using a combination of both. There's also guidelines specifically around strength training, so resistance training and building muscle. That's really important for our cancer patients, especially those who are on hormone therapies, and also about balance. So this is something that I promote a lot with older patients. So there's lots of research around frailty, but there is a little test that you can do, and I want you all to have a go at it tomorrow. When you go and put on your work shoes, I want you to balance on one leg, bend down, pick up a shoe, put it on and tie your shoelaces, but without putting your foot on the ground. So you're just balancing on one leg. Have a go at it. We should be able to do that activity till we get really old and unable to stand properly. But this is a balancing test. I have to say, when I first got taught this, I really struggled, but I've practiced it. I do it more or less every time now, and I'm much better than I used to be. So again, that's habit forming. I have formed a habit based on the fact that I know I need to practice balancing. So 92% of cancer survivors prefer to receive guidance from their providers, which is really interesting because it depends on maybe who is offering that advice. If they're in a gym or, their friend Betty's told them, oh yeah, you need to do physical activity whilst you're going through cancer treatment, the likelihood is that maybe they're not going to take that advice on board. Actually, if you in your uniform, you're looking after them through their radiotherapy, talks to them about physical activity and the guidelines and what is suggested to them, they're much more likely to take that on board and consider that. Some of the terminology that we use is really important as well. If you look at the National Social Prescribing Academy, they use the term prescribing. And I think this is really important. This is something that we need to do. We need to prescribe physical activity. It's important to kind of note that obviously from the research, some people are going to find it really hard to motivate themselves to exercise. And actually for those patients, they may need more of an intervention around behavioural support. So how I was talking about behavioural change management, that might be something that you need to initiate in more detail with your patients. Is that something that potentially you could do as continual professional development and start to implement? Swain et al. In 2024 also published some information about physical activity being really effective for reducing pain, which we absolutely know sometimes our patients unfortunately will experience pain as a result of the radiotherapy that they're receiving. And so actually it would be great to be able to prescribe physical activity to help counteract maybe some of the pain that they're going to experience. So to kind of reiterate, we need to be recommending aerobic and resistance exercise. It's going to reduce the toxicities of the cancer treatment that we're delivering, especially for things like fatigue. Back in the day when I was first newly qualified, I was heard saying every single day, take it easy, get lots of rest. It is now the worst thing that our patients can do. And actually it's starting to think about that personalization for each of our patients. What could potentially they do that is going to ensure that they are able to make healthy lifestyle changes and potentially also counteract maybe some of the side effects of treatment. There are also, just to be kind of aware that there are some interesting initiatives, incorporating physical activity into treatment. So we've had patients that have come on the podcast before that talked about actually they used a spin bike through their chemotherapy. And actually, I think the more that we're pushed to prescribe physical activity, we might see changes in our radiotherapy departments. The future might be that our patients aren't sitting in chairs waiting for their radiotherapy. They could be doing a physical activity. There could be a yoga class in a room. You'd be lucky to find a room in a radiotherapy department. To be fair, I think every space is always filled up with clinics or treatment, but this is somewhere potentially that there may be evolvement of practice, especially when we think about radiobiology and hypoxia, and the impact that potentially exercising before radiotherapy might have. So the next slide talks about Move Against Cancer and 5K Your Way. So I'm really lucky. I'm the Yorkshire Regional Lead for the charity. And it's a community-based initiative to encourage those living with cancer and beyond, for their families and friends as well, to basically join a community where they get to walk, jog, run, cheer. We've had loads of things before that patients can do, but it's an opportunity that the last Saturday of every month they get together. And actually, I love doing it because I get to exercise, I get to kind of talk to patients, and I've had cancer as well. So I kind of feel like I see cancer care from both sides. And as a consequence of that, it's really nice to go and talk to other people that have gone through the same thing, whilst also talking to patients about their treatments. And I learn lots. So I would definitely highly recommend it, even if you just go for the cake, which I maybe shouldn't say that because I'm about to go into nutrition. So next slide. So nutrition, as I said. So regarding dietary changes, the guidelines actually that are out there state that there isn't enough evidence specifically to support recommendation for or against any specific diets. So our general advice is around making sure that people are eating a well-balanced diet with lots of fruits and vegetables, and also recommending an increase in protein. So protein is needed for body maintenance, growth and repair. And it's present in all of our cells. It's absolutely fundamental for our cells to work properly. And as a consequence of that, trying to increase that when your body is trying to repair from radiation damage is really important. So some of the guidelines talk about the fact that if you have poor nutrition, it's going to impact negatively on physical function, your treatment tolerance, how well you're able to actually cope with treatment. It might impact on quality of life. Weight loss and weight changes, fatigue, and also impaired physical activity. So one of the things I have to remind myself is the fact that a lot of people have stereotypes of who is nutritionally healthy. So, if you were to go out into the street and I was to ask a member of the general public to walk past people and tell me whether they thought that they were nutritionally well or not, you would typically think that someone very slim, someone who had big muscles, they were going to be nutritionally well. And actually, we need to get rid of this stereotype because it isn't necessarily the case. I've got a family member who absolutely lives off processed food and is the skinniest little thing ever. And people would quite often think that, she eats like a bird. She doesn't. And, her diet is not the best. So we need to be really conscious about the fact that actually who is malnourished and what support and guidelines can we give them, irrespective of stereotypically whether or not we see them as someone who would be well nourished or not. I also have to say that for people working in radiotherapy, we need to think about personalizing the advice that we give. So, thinking about people's heritage, their cultures. A lot of life revolves around food. So I certainly know that I made mistakes when I was working in clinical, talking to a Southeast Asian woman about clotted cream. She had no idea what clotted cream was. I was like, increase your fat intake. You might want to have mashed potatoes and put cream in it. And she was like, Jo, what is clotted? I've never even heard of clotted cream. So you have to be culturally sensitive and ask people, what do they eat? What's the, what is their routine meals that they have? And how can you help support them to think about increasing fruit and vegetables and protein into their diet? It's also really important to think about food costs. Cost of living crisis has hit us all hard, and actually for a lot of our patients who might not be working or living off the disability allowance, buying fresh food may not be an option for them. So thinking about offering them solutions, offering practical hints and tips. The other thing to also mention is around fluid intake. So increasing fluid intake is really important when patients are going through treatment. Obviously, it depends on where we're treating in the body, but typically, the fluids are going to flush bacteria from the bladder. They're going to prevent constipation. Staying hydrated will typically make sure that treatment side effects are less severe, and therefore is going to lower the chances of our patients missing treatments or delaying cancer treatments. So talking to patients about how they feel and whether they feel dehydrated is really important. So the signs of being hydrated could be, feeling thirsty, a dry mouth or lips. So visually, you might be able to see if you think your patients look dehydrated, headaches, dizziness, sleepiness, decreased activity or energy, low blood pressure and increased body temperature. They're key signs that potentially someone is suffering from dehydration. Also offer alternatives. So not everyone likes drinking water. So think about, could people have squash? And also advice around alcohol and reducing caffeine is really important as well. My nana absolutely lived off of cups of tea. So, for me to try and hydrate her by getting her to drink lots of water was difficult, but we managed it by talking about maybe introducing fruit juices or sparkling water and things like that. So it's just having those conversations and offering that advice. I think personalization is just absolutely key. So talking to the patients about that. Next slide, please. So we often pay significant attention to the physical and biological implications of the cancer and its treatment. And actually, I'm really passionate about using the biopsychosocial model. So when I think about the biopsychosocial model, I have to consider, mental health. And mental health varies person to person. It may be something that people have never struggled with, but now with a cancer diagnosis and going through treatment, it's something that they really start to struggle with. So one of the things I would suggest is thinking about using a tool. So the UK mental health triage tool is a good tool to use and to kind of ask patients questions about how they're feeling. And then that gives you an indication of maybe what intervention you might want to use with that patient. Also remember that mental health disclosure is very personal. There is still, unfortunately, stigma around mental health. So not every patient is forthcoming about how they're feeling and coping emotionally. I think anyone who works in radiotherapy will be familiar with the patient who says they're absolutely fine and then are in floods of tears because actually they are really struggling emotionally with everything that they're going through. A very great friend of mine, I can call her doctor now because she just passed her PhD, Dr. Laura Charlesworth, conducted a literature review on severe mental illness. And again, this is an area that just is very under-researched. And she found that individuals with pre-existing severe mental illness and cancer have an increased cancer-specific mortality. And so, it's a really complex case, but what we need to know is that actually for anyone who is diagnosed with a severe mental illness needs to have prehabilitation in place early on. And it's imperative that we do that. And is that something that maybe we're screening for as patients are coming into radiotherapy? There are many counselling services available to patients, although, it is unfortunately a postcode lottery in some cases. Many free counselling services can be organised through cancer support groups. So the amazing work that Macmillan Information and Support Groups do and Maggie's centres. There's also some free NHS counselling services, telephone hotlines from specific trusts. Also, some organisations might charge, but they actually have a sliding scale dependent on people's financial situations. So finding out what's available for patients is really important. You can also go privately for counselling, and the fees for that typically will range between £10 an hour to £80 an hour. So again, kind of having some professionals who you can refer patients to and kind of give the details to, knowing that they know about cancer and have experience of counselling people with cancer diagnosis. There's also mindfulness. So, the definition of mindfulness is around the quality or the state of being mindful, and that practice of maintaining that complete awareness of your thoughts and emotions at that point in time. And so mindfulness has been researched quite a lot now within various aspects of cancer management. And actually it's proving to be quite beneficial for cancer patients in reducing toxicity and stress. So again, that's something that, again, you might want to talk to your patients about. So next slide is around alcohol use. So it's the most preventable risk factor for cancers, along with tobacco use and reducing body weight. So alcohol use actually accounts for about 6% of all cancers and 4% of all cancer deaths worldwide. And yet people don't always necessarily know the link between alcohol use and cancer. So overall, the amount of alcohol that someone drinks over time, and not the type of alcoholic beverage, seems to be the most important factor in raising that cancer risk. Most evidence suggests that it's actually the ethanol that increases the risk, and it's not the other things in the drink, although actually the research is really scarce, and so no conclusions can actually be drawn from that. Alcohol also has the ability to absorb nutrients such as folate, and folate is a vitamin that cells in the body actually need to stay healthy. So that malabsorption of nutrients from people who maybe drink quite heavily could again have an impact on their overall health. And there's some research that looks at the effect of alcohol on hormonal regulation. So again, it may be a contributing factor for people with hormone dependent tumours. There's also links between alcohol drinking and cigarette smoking, so it actually increases the risk and also has that contributing factor of worsening side effects of radiotherapy when combined. So moving on to smoking, again, research shows that smoking during radiotherapy and chemoradiotherapy is associated with worse outcomes and a higher risk of toxicity. It's one of the big things that anyone going for radiotherapy will be told by their therapeutic radiographer, their oncologist, about the fact that if they are going to smoke during their treatment, their side effects are going to be significantly worse. I think one of the most striking pieces of research is by the Journal of Clinical Oncology. It was funded by Cancer Research UK, and the study highlighted that for non-smokers, the long-term risk of death from lung cancer or heart attack caused by radiation, so what we're doing as part of radiotherapy, is 0.5%. But for smokers, it increased to about 5%, which is actually comparable to the benefit. So, it really is fundamentally the most important health decision that you can make for yourself in reducing your smoking. There's also lots of questions around vaping now as well. There's no good evidence that vaping causes cancer, but e-cigarettes are not risk-free. And I think it is really important to consider that, the data and research around this is not yet collated. And if you have never smoked, you should not be using an e-cigarette. They were essentially designed to help people reduce smoking. And the 13th of March is non-smoking day. So why not maybe utilise that as a time in the department to promote smoking cessation for patients and also maybe for staff as well. Next slide, please. So this slide, I'm really passionate about talking about pleasure, sex, intimacy, because it is definitely an area that I feel that as healthcare professionals, we don't talk about enough. We often hear from patients through Rad Chat that patients didn't feel they were informed of the consequences of treatment. And I typically hear healthcare responses, and mine's exactly the same, going, well, we did tell you because it's on the consent form. But for anyone who's ever been a patient, you will know that there's so much information to take in that consent consultation. And, knowing a statistic does not give you the kind of sense that, yes, I know what my life's going to be like with that late effect. It doesn't prepare you for what it's actually going to feel like and how subsequently you're going to deal with it. So it seems that people rarely receive information about pleasure and intimacy, and even less about prehabilitation of the sexual organs outside of that consent consultation. So thinking about maybe adjuvant treatments that patients are having, and thinking, actually, could we be utilizing the time that people start hormone therapy, but prior to coming for radiotherapy, to actually start to give them this advice? There's an amazing pleasure and intimacy book that I've put a link on there. Please do have a look at it. It's amazing. I also do want to do a big shout out to Will Kinnard, who's doing a PhD on sexual dysfunction and works as a clinical advisor for Prostate Cancer UK, and Samantha Evans, who is an ex-nurse and actually supports lots of cancer patients. She runs a company called Jo Divine and sells lubrication, and she has lots of experience in that field. And one thing I would kind of talk about in terms of prehabilitation is maybe promoting masturbation. It's not something that you would maybe want to talk about with every single patient. You would have to personalize it. But actually promoting masturbation, especially for patients who are receiving radiation for maybe gynecological cancers or male reproductive cancer, it can help with increasing blood flow, relaxation, reducing stress, helping with pelvic floor muscles. It can help with sleep, alleviate pain. And one of the coined phrases that, again, people use within kind of sexual dysfunction is use it or lose it. And it's definitely something that we suggest for lots of our patients. And Prostate Cancer UK also highlight that many men going through prostate cancer say that actually sexual dysfunction and relationships are the biggest issue that they have to deal with during their cancer journey. And so how can we as healthcare professionals try and lessen that impact? There's also amazing resources around queering cancer and Outpatients UK. So for anyone who wants support with talking to people from an LGBTQ plus community, please do make sure you check those out, because they are absolutely fantastic. Sorry, I appreciate time, so I'm whizzing through. So now the workforce, how are we going to look after you? Because you have to do so much, and I'm telling you things that you might also want to add to your day-to-day activities with patients, but we need to look after you. So if we look at the next slide, I just want to remind you that actually it is a HCPC standard of proficiency that's recently been updated, that you have to look after your health and well-being and seek support if necessary. So a piece of work that I did with Wang, Hutton and Pennington, we looked at actually why therapeutic radiographers or healthcare professionals don't offer prehabilitation advice. And there were lots of reasons, but one that stood out for me was the hypocritical nature of, I'm advising someone on sleep hygiene, or I'm advising someone on exercise and nutrition and not drinking alcohol, and I know that I do all those things. So we need to start practicing what we preach. So if we move to the next slide, I just want to give you all some helpful hints and tips and start to think about how you can look after yourself. So in the last year, pressures across the NHS have increased significantly. We see it over the media every single day. Vacancy rates are an all-time high, cost of living, NHS is having to cope with strike action, industrial action, demand for healthcare increases. Sorry, that sounds actually really depressing. I'm going to scrap all that. We know how bad the situation is, unfortunately, at the moment. So we need to make sure that we put on our own mask before trying to help others. So knowing what to do for yourself is really important. Remember that it's not just GP practices that you can go to if you feel you need help. Pharmacies now are absolutely equipped to help and support people, and even with mental health advice as well. There's also something called the Self-Care Forum, which has some amazing self-help sheets, which again you could utilise or share with your family. And I would say about having a healthy team can really support team working and improve our own well-being whilst we're at work, which has a better impact on our patients. So, socialising. We know that women live longer than men because we socialise more. The research proves that having socialization is really important for us. So we need to think about that as well. There's a picture up there of some women walking, and actually that's the Western Isle Hospital, and they're a walking group and they go out every single lunchtime. Maybe that's something we need to start initiating in our radiotherapy departments. Sleep hygiene is always something that I bleat on about to my students, because I know they're watching Netflix on repeat until 1 a.m. But it is really important. Be consistent. Go to bed at the same time each night. Get up at the same time each morning, including weekends. Make sure your bedroom is at a comfortable temperature. They usually say 2 degrees less than what it is during the day. Remove electronic devices. Do not go on social media. Put your phone outside of your room. Avoid large meals and caffeine before bed, and stay physically active through the day. Also really important to hydrate yourself. Remember to drink, have a balanced diet. All the advice that we've gone through is really important, not only for our patients, but for ourselves as well. The last thing I want to go through, so I apologize because of time, but is the 5 simple questions as part of this personalized mental health action plan. So it gives amazing questions that you have to answer, and they're personalized. So eventually, once you've completed those 5 questions, it will give you a plan, and that plan will essentially give you a 4-week email and helpful reminders of what you need to do to help improve your mental health. So, if from today you are feeling overwhelmed at work, you're not sleeping very well, try just taking this 5 simple questions. Think about, how you can personalize your mental health action plan, and hopefully start to adopt that. So I'm going to let you just quickly scroll through. Sorry. If you can just scroll the next one, please, Lindsay, and the next one. Thank you. So just to shout out to some resources that are available. So this is the Northern Radiotherapy Network information videos. They are absolutely brilliant. They are from prehabilitation all the way through to late effects. So please, please, please do go and take a look. There's also Radiotherapy UK. They have some new resources coming soon. So absolutely save them in your favorites. They will be available. If we scroll to the next one, please. Here we have an e-learning. So for anyone who wants to do continual professional development in this area, I'm slightly biased because I helped develop this one with Macmillan, but it's e-learning for prehabilitation, rehabilitation and personalised care. I also run an MSc module. So for anyone who might be interested in doing some MSc study, it was co-designed with Macmillan, and essentially that MSc module is for anyone. You don't have to have a first degree or a 2-1 degree. It's very accessible, and actually even accessible to people that work in as maybe sports scientists, or maybe work with patients in gyms. It's really accessible. There's also Rad Chat. So for every podcast episode that we do, we have associated reflective points, and we are continually professionally developed with CPD now, which is the Society College of Radiographers. Next slide, please, Lindsay. And then for anyone who wants to develop their knowledge about maybe some of the interventions that I've talked about tonight, these are some really good ones. So there's the alcohol and tobacco brief intervention. There's also the National Centre for Smoking Cessation. And then there's also, I absolutely love this. So if I was a leader in the NHS, I would absolutely want to have a look at the final resource on the right. And that is basically looking after your team's health and well-being. And it's essentially a toolkit, but it is brilliant. And it goes through really practically things that you can do collaboratively with your team. Next slide, please. So I won't talk about the amazing Oncology Professional Care Conference, but it's just to be aware it exists. Please do go Google it, have a look. It's open to everyone working in oncology, and it's a great conference, largely because lots of different oncology professionals go there, and we're really lucky that we have a radiotherapy theatre this year. So, you know, we're flying the flag for radiotherapy that didn't exist for 2 years at that conference. It was very pharma heavy, and it's amazing to have Radiotherapy UK there as well. I do believe, I've just seen one of the questions pop up about students. I have asked the question, I believe they can do, yes. But I will get absolute confirmation for you. Next slide, please. And the next one. And please do feel free, if anyone has any questions, I know time has run over, but I'm more than happy to go through the chat and respond to them, and we can email it out. But also feel free, absolutely, to drop me an email or just drop us a DM on any of the social media channels via @rad__chat. Thank you very much. I'm going to have a drink.
Thank you so much, Jo. That's absolutely fascinating discussion. And also, I mean, just running from the continuum, you know, of patients, prehab, potential impacts and their effects, but then also on the workforce themselves and the ability to look after yourself, to be able to help you better look after patients. You know, it's so important. So thank you so much information, so detailed. I think, as Lindsay has said, we will, in the chat, we'll send out all the links as well for people to be able to peruse at their leisure. While we have you here, we're totally over time, but that's grand because it was so fascinating. We might just take 1 or 2 questions while we have you, because it's always really good to be able to hear your responses to the questions. And I do know that, you know, we'll also share your details so people can contact you in Rad Chat if there's something they'd like to follow up on as well, but doesn't get answered tonight. So I'm going to hand over to Lindsay. And Lindsay, would you take forward the questions?
So the first one we've got is, can I ask, do you have any prehab to get people to relax as much as possible at the CT stage, so that you can have an easier daily setup, more sort of mental preparation rather than physical?
Amazing resource called Respire. So if you were to just go on and Google Respire, it was set up by my amazing colleague, Dr. Heidi Prost, and she essentially co-produced resources specifically for breast cancer patients, but they can be used by anyone who are going for their pre-treatment CT scan and then subsequently their radiotherapy treatment. And they were going to have something called deep inspiration breath hold, where we have to kind of vary the breathing specifically for that treatment. And so they created some mindfulness breathing relaxation videos. And there's also some amazing videos of the procedure at pre-treatment and also treatment. So we can absolutely share that in the chat as well for a link to that. But it's a great resource, and whoever, I don't know who it was, I think it was one of my colleagues, but their voice is incredible, because I just find when I listen to it, I instantly relax. So I would imagine that for patients, it will be equally as relaxing as well. But it is practice. So again, if you give it to a patient like the day before radiotherapy's pre-treatment, it's not going to work. We need to be able to give this advice and support to patients well in advance, so that they have time to digest it. Lives are busy, you know, giving it to a patient the day before or at one appointment and then saying, right, you're coming for treatment in 2 weeks' time, quickly practice this, it's not going to benefit them. So, you know, liaising with our colleagues maybe further along in the pathway could be really beneficial.
Great, thanks. Next one, are all hospitals supposed to offer rehab? Because of a patient never received this from 8 years ago when they had their treatment.
Yeah, it is really, really unfortunate. We are doing a lot within radiotherapy services, thanks to like the amazing work of Lisa Duran and Emma Hallam. You know, there's some pioneers in supporting patients with late effects, but there is a postcode lottery. It doesn't exist in every single trust. Typically in radiotherapy, we have always kind of delivered the treatment and then we didn't see our patients again. We never want to see our patients again, because that means that, you know, we've managed to cure them. But now what we're able to do, and because of our scope of practice and the skills that we've developed, is that we do kind of see patients, we do follow up and things like that. You know, we've got amazing advanced practitioners that run radiographer review clinics. And my advice would always be to phone the department and see maybe what is available for patients, but it is very, geographically dependent on where you live. Late effects clinics is definitely something though on the agenda, so I'm hoping practice will change in the future. Everyone should have a clinical nurse specialist as well. So, phoning your oncologist secretary might also be an option for you. And it's never too late. Unfortunately, we know that with radiotherapy, it is the gift that keeps on giving. So even if you are 8 years post-treatment, if you have any side effects from radiotherapy, it is important that you get the support that you need. And that might be going through your GP and talking about the fact that you think this is a radiotherapy side effect, or trying to track down your oncologist, or phoning your radiotherapy team and asking for help and support. Please don't feel that you can't do that, because we would, as a profession, we would absolutely hate to think that people are sitting at home with late effects and they've got no one to help or support them.
I've just got one more I'm going to hit you with.
I could go all night, Lindsay.
Is there any link between nutrition and skin integrity for patients undergoing radiotherapy treatment?
Yeah, so maybe, I suppose it's about the integrity of the cells, not necessarily just the skin. So things, when we look at kind of the physiology behind the molecules that form our cells, it's really important to think about the fact that it's made up of proteins and largely water. So if your nutrition is poor, your cells aren't going to be able to withstand as well the radiation damage. So, from our perspective, keeping hydrated, having a high protein diet, having fresh fruit and vegetables to create those, deal with any of those free radicals, that is going to be what essentially is going to help and support our patients. So good nutrition is absolutely imperative for our whole well-being, including our skin. And moisturize, moisturize, moisturize. Get everyone moisturizing.
Brilliant. I think that's us then. Thank you so much, Jo. Like, absolutely incredibly fascinating, and you're just so inspired by your knowledge and your expertise, but also your passion for delivering, really high quality radiotherapy for patients. And also, we're such a big fan of your work with Rad Chat as well, with what you and Naman are doing there, making radiotherapy accessible to so many people who it hasn't been before. So well done. And thank you so much for your time this evening.
Thank you. I'd just say a huge thank you to all the patients that educate me, because without that, I don't think I would have the knowledge. They've come to me to educate me, which has then forced me to go and find the answers. And so it's absolutely the patients that we have to thank for service development, service improvement. So thank you.
Brilliant. And hopefully, as we continue to grow and develop as a charity, we can be another platform for that to come through, and for patients to be able to share that and kind of all work collaboratively to continue to inform and empower patients to be a real collaborative part of their treatment. So thank you also to the audience for really fantastic questions and comments. Please do remember to leave a comment with your one takeaway from this evening. And now, just very quickly, I'm going to share a few updates from Radiotherapy UK. So the first one is about our Stephen Fry week, which was amazing last week. So as many of you hopefully will have seen, we did have a bit of a crazy week last week whenever Stephen Fry pledged his support for our Catch Up with Cancer campaign with a video message, which then snowballed into 100,000 signatures in one day in support of the 4 in 10 people who are waiting too long for cancer treatment. So we're now well past the 500,000 mark, which was our target. And we think that is such a strong position to continue our call for change, especially at a time when all the parties are thinking about the upcoming general election. So a huge thank you to everyone that signed. And if you haven't yet, please do sign and continue to share and really help us to keep the momentum up. The link to the petition is going to be posted in chat, and the aim is to get the government to adopt a national cancer plan, a body to implement that plan, and tackle the long wait times for cancer treatment, and obviously from our perspective as well, ensure that radiotherapy is embedded within that cancer plan. So the next slide just talks about our radiotherapy vision, because never let it be said that we only focus on the problem. We're also all about solutions as well. And earlier this year, we were really, really proud to facilitate the launch of the 10-year vision for radiotherapy. It's world-class radiotherapy in the UK, right patient, right treatment, right time. And all the evidence points that radiotherapy should be a major player in improving cancer services in the UK because it's cost effective and has such a huge scope to help patients live longer and better. It's driven by an incredibly skilled multidisciplinary workforce, and it's just primed to harness so many of the innovative technologies that are coming through at the minute. As Jo referenced earlier on, I mean, within the UK, only 27% of patients currently access radiotherapy, and the international consensus for the UK is that should be closer to 53%. And there was research came out yesterday which also showed that patients in the UK have much lower access to radiotherapy and chemotherapy than in other comparable countries. So we do know that there's a massive issue here. And we also know that radiotherapy is the second most effective cancer cure. It's incredibly cost effective, and we need to improve patients' access to it right across the UK. So if you want to read the vision, the link is in the chat. And we're going to have a big program of communications over the next 6 months to promote it. So please do help us to keep getting the word out there, both to the public and to the decision makers. And then lastly, I'd like to welcome you all to join us for this year's Miles for Radiotherapy Virtual Summer Challenge, which we will be launching really soon. So to develop things like the vision and the Catch Up with Cancer campaign, we really need support. And I suppose what I would say is that our team needs support. We're a really small team. We're a tiny charity, and we're trying to tackle major issues and impact major change. And this summer challenge is a wonderful way for you to have a memorable, healthy summer, linking in with Jo's chat about looking after yourself as well, and while also doing whatever fundraising you can to support the charity. And we're already off to a really super start this year, with Bella from Oncology Imaging Systems taking on the Liverpool Half Marathon for us, and the wonderful Georgie, who had radiotherapy to treat breast cancer, taking on a 250-mile solo hike to raise money for Radiotherapy UK and 3 other charities close to her heart. Huge thanks to Bella and Georgie for setting the tone for what we hope will be our best fundraising year yet. Please do sign up to our Radiotherapy daily newsletter if you want to be the first to hear about the launch of the Miles for Radiotherapy Challenge and how you can participate. So thank you all so much for coming this evening. And I suppose that's it from us. We wish you all a really good evening, and we hope you enjoy the rest of your night. Thank you.